Hello everyone, my name is Dr. Satish Kini. I am a cardiothoracic endovascular surgeon. Today I am going to speak about a blood thinner. It is called as warfarin sodium. You may wonder why I am talking about this particular drug. In the medicine world, there are thousands of medicines. And why do we talk about this medicine called as warfarin and give a talk about it? It constitutes a very important drug in our practice. Very commonly used. Also, very interesting medicine. It saves life, and if not taken properly, it can cause life-threatening bleeding. And that is why I am giving this small talk. The medicine warfarin in medical practice is used for various conditions. Commonly used conditions are, in my practice, in cardiovascular practice, is after heart valve replacement, one has to take warfarin sodium for lifelong. Or if you have a condition called deep vein thrombosis, then you need to take this medicine. Of course, there are many other conditions where you need to take this medicine. Like somebody has an irregular heart rhythm, you need to take warfarin. Also, sometimes if you have a heart attack, your doctor will prescribe a warfarin for some time. But commonly, majority of patients will need warfarin after heart valve surgery and a condition called as deep vein thrombosis. Let us go through each condition one by one briefly. Talking about heart valve replacement. There are 4 valves in the heart. They get damaged because of various conditions and problems. And what we do for that those valves, we need to replace them. It is called heart valve replacement. Generally, these valves are replaced with mechanical valves. By mechanical valves, I mean it consists of a fabric material and a metal component. So the valve, which is a metal sewn on the fabric component, sits in the heart valve position. Obviously, anything in circulation inside the heart is going to cause clotting. Blood clots by nature, blood clots around the heart valve. To prevent this blood clotting, if we replace the heart valve with the mechanical valve, one has to take warfarin for the life. Now, talking about second condition called deep vein thrombosis. This is also a common condition. Generally seen after pregnancy in young females. Also, it is seen in elderly people after prolonged recumbency or operation. This is generally because of not moving your extremities, lower limbs. If you don't move your limbs, like with physiotherapy, blood is going to accumulate in the deeper veins in the leg. This leads to stagnation of blood in the legs, leads to formation of blood clot. Any stagnant fluid is going to clot. Now, what happens with this clotting? Once the process of clotting starts, it will increase the clotting in the whole system. And if the clot progresses, it will lead to a condition called as pulmonary embolism. By that, I mean the clot fragments from it. It will fragment from the leg and it will go to the heart. This is a fatal condition and person can die of pulmonary embolism. So to prevent pulmonary embolism, we treat the patient with warfarin. So how do we start it? Normal recommendations are daily 1 tablet in the evening. How does it act? It inhibits the clotting factors some clotting factors in the blood. By inhibiting the clotting factor, it prevents the blood from clotting. And normally we want the blood to be thin 2 to 3 times the normal. We'll talk about it in short time. So this tablet is started every day in the evening. It takes about 2 to 3 days to act. Every person has different reaction to the body, to this drug, and he may take 1 day, 2 days, 3 days for the action of the drug to come. Once the medicine starts acting, we stabilize the dose and then medicine is continued for a period of time. It may be 6 months to lifelong, depending on what problems you have. Now, how do we monitor this drug dosage? Like you have diabetes, you monitor your sugar. In a similar way, you go to lab and a blood test is done. It is called prothrombin time or INR testing. Generally, it is referred as INR testing, which means internationalized normalized ratio. Short form is INR. This test is available all over the world, any part of India. So once a person is started on warfarin, INR is done periodically. Like when you start for a first day, we start doing every day for first week. Then maybe alternate days. Then maybe twice a week. Then once a week. Then 15 days, 1 month, 3 months. So the periodicity slowly increases. And over a period of time, you may have to do the test every 3 to 4 months. That is all. So once the dose is set up for a person, which may take a month or so, further every 3 months he can do the test and then continue with the medicine for the specified period of time. Are there any side effects of this medicine? Yes. Generally, it is just, there are not many side effects. It does not cause any nausea, vomiting or acidity. But if not taken properly and if INR is not monitored and blood thinning goes up, then it can lead to bleeding problems. Bleeding can be small or big. That's why I told first time that this drug is very interesting drug. It is a very safe drug to take, provided it is monitored properly. So blood thinning or INR, we generally keep 2 to 3 times the normal. I would say INR 2.5 to 3.5 is very ideal. But question is, can you stay in that range for life or 6 months maybe? Yes, you can. What you need to do is have a disciplined life when you are taking warfarin. Avoid certain vegetables, alcohol, and lead a normal life. Your dosage will not change much. What is to be avoided? Generally, the green leafy vegetables, as a rule we say, the green leafy vegetables, they contain vitamin K. So the green leafy vegetables to be avoided. Commonest, which is available in India, spinach or palak, lettuce leaves, cauliflower, broccoli, cucumber. So if we avoid these vegetables, rest anything can be consumed. Normal dal, chawal, normal pulses, non-vegetarian items, everything can be consumed. Alcohol, we generally say not to have alcohol. So, if you follow these minor instructions, the INR can be maintained in the normal therapeutic range, which is like 2.5 to 3.5. Other two things which you have to remember is, in young females who want to become pregnant and have children, they must inform the doctor that they are on warfarin. If you desire to have pregnancy, then warfarin must be stopped for a period of time, and this your doctor will do. So if you are going to be pregnant or you have become pregnant, inform your doctor and take the correct medicines. Secondly, if you have any surgery or you go to doctor for any kind of problem, you notify this saying that you are on warfarin. They'll understand. These things you must always remember in mind. And while taking warfarin, you have to be little careful to observe your body and body fluids. Make sure when you brush, no bleeding occurs in the gums. Normally, if the INR goes up, you will have bleeding from the gums, urine, stool, or nose. So watch for this bleeding. And if you have bleeding, just stop warfarin, go to your doctor and get your INR tested. I think I have talked clearly about warfarin. I hope this information helps to you guys. Thank you.